Just be happy with who you are. Just be happy with who you are. Just be happy with who you are.
Okay, let's look at the somatic symptoms and related disorders. This is part 2. Now, consider this. Casey is a 30-year-old man who was very afraid he might die of cancer, as his mom had died of cancer several years ago. He made frequent visits to the doctor. He complained of pain in his left leg. He began checking for lumps in his leg several times a day and reading about cancer on the internet. He went to the emergency room complaining about pain in his leg, thinking it was a sure sign that there was a tumor growing, and after conducting several tests, the doctors found nothing wrong with his leg and reported that he was in excellent physical condition. After a year without a diagnosis, Casey found that he was experiencing chest pains in addition to the pains that he felt in his leg. He went on to the emergency room 3 times, certain he was dying of a vicious cancer that had now spread to his lungs, and each time the doctor assured him that his pains might be real, but they couldn't find any physical cause. Casey decided the doctors were simply not competent enough to find his disease, and he then went and became increasingly frustrated and began to stay at home as much as he could to learn about his perceived condition and to chat with other cancer patients on Facebook and MSN. His relationship with his family and friends had become strained, and he's becoming increasingly socially isolated. In somatic symptom disorder, there is a physical complaints that cannot be accounted for by organic causes. Thus the symptoms are theorized to reflect the psychological rather than organic factors. Overly preoccupied with their health or body appearance, no identifiable medical condition causing for physical complaints. Examples that we look at include conversion disorder, illness anxiety disorder, somatic symptom disorder, and factitious disorder. Now we're going to start with conversion disorder. It's a functional neurological symptom disorder, and in conversion disorder, I got in brackets for you to sort of keep in mind, functional neurological symptom disorder. Symptoms or deficits in voluntary motor or sensory function occur which suggest that an underlying physical disorder, but no apparent medical bias or basis for the condition can be found. Symptoms are not intentionally produced. The person is not malingering. And that's a very important distinction. Physical symptoms usually come on suddenly in stressful situations. These symptoms can include patterns of paralysis, epilepsy, problems with coordination, blindness, loss of hearing or smell, or loss of feeling in a limb. Now this would no doubt concern you, but to a person with conversion disorder, they seem and appear unaffected. This is known as la belle indifférence, the beautiful indifference. Now, if you're looking at anxiety disorder, the second somatic disorder we'll look at is the preoccupation with fear of having or the belief that one has a serious medical issue, but no medical basis for the complaints can be found, and fears of illness persist despite the medical reassurances. Now, one subtype, the care avoidance subtype, applies to people who postpone or avoid medical visits or lab tests because of high levels of anxiety about what might be discovered. The second subtype, called care-seeking subtype, describes people who who basically are going doctor shopping in the hope of finding the one medical professional who might confirm their worst fears. Faking or real? Well, people with illness anxiety disorder do not consciously fake their symptoms. And this is an important element about all these psychological disorders. They may seem so fanciful, how could anybody ever not know that they were faking? But that's one of the keys to the disorder, is that they're not consciously trying to make things up. Their symptoms they're not trying to fake their symptoms, but they fear their symptoms are due to some real illness. Feeling resentful towards their own doctor, they often go doctor shopping. Now, this condition is formally known as a term you might be more familiar with than anxiety disorder, and that is hypochondrias. Now, semantic symptom disorder. People with semantic symptom disorder have troubling physical symptoms, and they are excessively concerned about their symptoms to the extent that it affects their thoughts, feelings, and behaviors in their daily life. Now, symptoms may include such complaints as gastric, that is your stomach distress, various aches and pains. Somatic symptom disorder usually begins in adolescence or young adult and appears to be a lifelong disorder involving major disability. Now, we'll also look at is the factitious disorder. Factitious disorder is a type of psychological disorder characterized by the intentional fabrication of psychological or physical symptoms for no apparent gain. Now, there's two major subtypes of factitious disorder. One is factitious disorder on self. This is what is characterized by faking or inducing symptoms in oneself. And then there is also a fictitious disorder imposed on others. And this is characterized by inducing symptoms in others. Now, this first type is used to be known as Munchausen syndrome. And the second type was known as Munchausen by proxy syndrome. Now, the theoretical perspectives that sort of explain this, well, the psychodynamic view holds that conversion disorder represents the conversion into physical symptoms of the leftover emotion and energy that is cut off from the unacceptable or threatening impulses that the ego has prevented reaching awareness. So the id gets shut down, and the id sort of, as a result, the ego's defenses move in this direction. The symptom is functional, allowing the person to achieve both primary and secondary gains. The primary gains from the psychodynamic theory is the relief from anxiety obtained through the development of a neurotic symptom, whereas the secondary gains, these are the side benefits associated with neurosis or other disorders, such as the expression of sympathy and the increased attention from others and the release from ordinary responsibilities. Learning theorists, well, they focus on the reinforcement that are associated with conversion disorders, such as the reinforcing effect of adopting the sick role. In sociology, the sick role would be what are the appropriate things that one must experience in order to be sick in our society and have it be legitimate. So in terms of the abnormal psychology component, is adopting the sick role would be to behave in ways that are normal for being sick, and therefore learning to get the appropriate responses for being sick. A learning theory view likens illness anxiety disorder to obsessive compulsive disorder, whereas cognitive factors in illness anxiety disorder include self-handicapping strategies and cognitive distortions. Remember, that's very common in cognitive factors, our thinking. Cognitive theorists look into the role of distorted thinking, oversimplified as making mountains out of molehills. People may exaggerate the importance of symptoms and produce excessive anxiety about their well-being. So the treatment for this? Well, psychoanalysis seeks to uncover and bring to the level of awareness the unconscious conflicts originating in childhood that are believed to be the root of the problems. And that's a very common approach for psychoanalysis, looking at childhood experiences and past unconscious conflicts. Now, once conflicts are uncovered and worked through, the hysterical symptom should disappear because it's no longer needed as a partial solution for the underlying conflict. The behavioral approaches focus on removing sources of reinforcement that may be maintaining the abnormal behavior pattern. Behavior therapists might also work more directly to help people with somatic symptoms and related disorders learn to handle stress and anxiety arousing situations more effectively. So they'll learn different strategies for stress management, meditation, breathing exercises, eating correctly and other exercises, and skill development to better handle problem solving of life's issues. Biological, well, antidepressants are, and especially the SSRIs like Prozac and Paxil, are having limited success, but it's not a standalone treatment. Often medication is used alongside other such treatment options as behavioral, learning, and cognitive. All right, now I know this has been a relatively brief one. It's partly because this is not one that gets an awful lot of play in psychological disorders. It's not common. All right, so good luck, everybody. We're done in the dissociative and somatic symptom and related disorders, and I hope you are getting at your work and are enjoying this course so far. So I look forward to seeing you next week. Now, as you noticed, only 2 videos this time. I've really just divided them down into dissociative and somatic. Bye now.